Welcome to On the Spectrum. I'm Laura Walters and I'll be your host. Today we welcome as our special guest Senator Dante Bartolomeo, Assistant Majority Leader for the Connecticut State Senate. Senator Bartolomeo is also the chair of the Committee on Children and also the Higher Education and Employment Advancement Committee. I think you're going to enjoy hearing from the Senator today about the laws that have been passed in Connecticut and the bills that they're considering. So if you're on the spectrum or related to someone on the spectrum, I think you're going to appreciate our lively discussion today. So with that, Senator, let me welcome you to the program, and thanks for coming.
Thank you, Larry. It's really my pleasure.
Great. So as we get started, tell us a little bit about your background. What led you to run for office, and tell us about your current role there at the Senate.
Well, interestingly enough, actually what got me into politics was that my oldest son has special education needs. So when he was about 2.5, we realized that we were going to need services from the schools, and it was an incredibly difficult challenge for us to get those services. His needs were not necessarily clear-cut, and so we really had to fight and advocate to get his services. After I learned how to navigate the system, I then became a volunteer advocate for a few other families in my community, which that then put me in the position of going to a lot of education meetings, a lot of city council meetings, and there happened to be an opening on the city council, and I was asked if I'd like to be appointed to that. I spent a few years on the city council, and then there was an opportunity for the Senate, and here I am. Wow,
great. So tell us about your role. You're Assistant Majority Leader up there? Yeah,
I am.
Tell us something about that.
Probably more importantly, I'm the co-chair, as you said, of the Children's Committee. I'm the co-chair of the Higher Education, Employment, and Advancement Committee. I also serve as a member of the Education Committee and a member of the Appropriations Committee.
Wow.
So that's really where I do my work. You know, the title's the title, Assistant Majority Leader, and it's nice to have, but really getting down and dirty and doing the work is at the committee level.
Tell us a little bit about these committees. So let's start with the Committee on Children. What are some of the things that they're working on?
Well, you know, I couldn't have been more fortunate than to be placed as the co-chair my first year of the Senate in this committee. As I said, my background of special education, my own children, but also I have a sister who was adopted and in foster home for a very long time, and then came to us at 3.5 years old. And unfortunately, she ended up having many years of mental health issues from 14 to 30. She's now 40 and she's doing phenomenally well.
Oh,
she's
great.
Living independently. She's working part-time.
Wonderful.
She's going to community college. But the experiences that my family went through while she was ill are that combined with the experiences of my son. When I brought those to the Senate and became the co-chair of the Children's Committee, I've been fortunate enough to do legislation around both of those issues. And so that's really been a thrill and a pleasure, and probably some of my work that I'm most proud of.
Oh, that's great. Tell us about the other committee, the Higher Education and Employment Advancement Committee. What are the things they're focused on?
So that I'm new to. I've been the co-chair of this for just under a year now, just since this last term. Quite honestly, I was a little concerned because it was a bit out of my wheelhouse. I have a son in college and I pay tuition, but that at the time was really kind of my credentials for that committee. So it's something I've had to learn quickly. We have cognizance over the University of Connecticut and their Board of Trustees, in addition to the Board of Regents. Now, the Board of Regents has 17 institutions under them. Our state universities, our community colleges, and Charter Oak. So we are we're working on legislation related to not only higher education, but also, as you said, employment advancement. The other thing is that I serve on the Appropriations Committee, but on appropriations, senators, because there's so few of us, also have to co-chair a subcommittee. So appropriations is where we do the spending, right? We decide where we're going to spend money. I chair the higher education division of appropriations as well. So when we're talking about budgets for higher ed, that's under my purview. And then for Education Committee, I don't have a leadership role in that committee. I'm a member, but again, my experience with my son is really lent itself well to being a member of that committee.
Right. Well, I think I'm hearing it, but tell us a little bit about some of the things you care most about and what you hope to accomplish up there as Senator.
Well, I would have to say, it's hard to say. There are so many issues under our purview that are really exciting. I mean, even things like, Lyme disease education or pesticides on school grounds, concussions, and, that kind of stuff comes under Committee on Children. But the work that I've been able to do around children's mental health, as well as probably most recently also, you know, up there with that is the work we did on restraint and seclusion in schools. So those two issues are really things that I've been fortunate enough to dive deep into and really work hard on.
What's the sentiment or the climate up at the Capitol regarding these issues? How would you
Well, you know, it's interesting. So the year that I came in was January of 2013. So the tragedy at Newtown had just happened. And that was, you know, December of 2012. So when I came in, what was unique about that was that I came in with this background of, you know, seeing what my parents didn't get and what my family and my sister didn't get as far as supports and services when she had mental health issues. And those were some very concrete things I wanted to work on. There also had been a group of advocates that had been working together for quite a few years and looking at what were the gaps within Connecticut's mental health system, if you will, because there really wasn't a system at the time. And so those advocates came to me as the committee chair and said, we've been working on this. We even have language around making changes. Are you willing? And I said, absolutely. The third piece of it is that because of the tragedy at Sandy Hook, I think many of the legislators who previously may not have thought that mental health issues were something that affected them could now see that it affects all of us. So they were much more open to making some changes. The bill we passed that year is called Public Act 13-178, the mental emotional behavioral health of children. I actually wish in hindsight we named it something to do with children's wellness, but it really dictates a framework by which all of our state needs to approach children's mental health with, and we passed that unanimously, which was really quite a feat, both in the House and in the Senate. So it shows that people were really receptive and listening to issues around children's mental health.
And the governor signed it. Congratulations.
Yes.
For the freshman senator, and have a bill passed into law. That's wonderful.
Yes.
Tell us about some of the key features of that bill, as long as you brought it up.
Well, so what it really does when I speak about a framework, so it says that anyone in our state, whether it is, and I'll try not to use acronyms because there are so many, but the Department of Children and Families, which most people had thought, well, that's our agency that deals with children's mental health. Well, but you know what? It shouldn't be just looked at as, because not all children with mental health are under the care and custody of DCF, right? So we need to also know that if it's Department of Social Services who does things like birth to 3, that they need to also be following this same framework. Whether or not it's Department of Public Health, because they also have home visiting programs. Or if it's your local provider at a community health center or something like that. So the framework that we've established is that they need to work towards things like prevention, early identification, early intervention. Their methods need to be culturally, based, diversity based, and we basically set up this whole framework. And then we developed a plan. We had a group work for over a year developing a plan. And also recognizing, like I said before, it's not just a DCF issue. But that means that we need to have our private insurers recognize that they have a responsibility here too. And there are federal parity laws, meaning that private insurers need to treat and pay for that mental health treatment at the same level that they do general health. And so that's been another piece of this in order to kind of work on wellness for all of our children. So the working group spent over a year developing a plan. It was very consumer oriented. Parents had listening forums, kids had listening forums. And then we now have this is another Public Act 15 that we did this year, 127, I believe, that is keeping that board together, that advisory board, so it's not just a bill on a shelf, but it's keeping all of those stakeholders at the table.
So is this plan that you've put together, is this something that's going to be implemented at the state level, or does it get implemented at the local level? How does that work? How do you see it getting rolled out? So
pieces of it's probably going to be like a 5-year plan, and we have it very delineated on what needs to happen when, under which agencies, and also the cost that might be associated with it. And so we're working constantly with this advisory board to let us know in the legislature what are we ready to do? For instance, Emergency Mobile Psychiatric Service. It's referred to commonly as EMPS. That is a service where if you have an acute situation, a child who's in an acute crisis, let's say that's in a school, the school would now call 911 if they felt they couldn't handle it.
Right.
Well, that doesn't go anywhere it doesn't go anywhere good very often. And it also, for some children, gets them into that juvenile justice arena, which we don't want to see when the problem is rooted in mental health or other. So if they call 211, then they get this emergency mobile psychiatric service, who these people are trained in treating the specific type of problem and specific type of youth. And then they also have things like they engage family and discharge planning and all of that. So it's really the best scenario. That's run by DCF. We have 167 school districts in the state of Connecticut.
Wow, that's great.
The legislation requires that they have a memorandum of understanding with the EMPS so that they know what it's about and they go to it first. Right now we have about 47 signed, so that's something that we're continuing to work on based on this legislation.
What are the challenges in getting a school district to sign on to that? I would think everyone would jump onto that immediately.
Well, I thought so too, and I learn as I go every day. We have tried multiple ways of getting each and every one of them to sign on. The State Department of Education is working with us on that. It may simply be a scheduling issue for them to take the time to learn, but it needs to happen. We need to continue to push it. And the fact that we have this advisory board established and in statute to continue to implement the plan will make certain that we continue to do that.
So how that works on the local level, if you have a situation at a school where a child has a behavioral issue, instead of calling 911, the school officials would call 211, right?
Right.
And then you get really trained professionals who can handle that.
Right. If this child is in crisis and they know that this is related to, behavioral issues related to things like autism or other, other mental health issues, and it's not just strictly a child who's misbehaving and had a fight in the hallway just because they were misbehaving. I mean, those are different issues. Some schools have officers within the schools, some don't. That's not what we're talking about. We're talking about those that are, emanate from mental health issues and things.
I see. So you want people who are trained to really handle this, and that makes sense.
And then they engage the families, and they offer suggestions and treatment possibilities if they are needed. They engage the families, as I said, in kind of discharge planning from that call and follow up.
I would think the families would also want this. And is there an opportunity for the families to perhaps talk to the school districts to get additional schools to sign on?
I would love that.
Okay, great. Well, maybe that's an opportunity that could come out of the show, that people are now more aware of it. So that may be something
call and
to
ask if your local school district or regional school district has engaged DCF to understand and learn about emergency mobile psychiatric services.
EMPS.
EMPS.
Good, okay. Now also, recently you've introduced another statute, or another bill, I should say, into the legislature, and this is on a ban on physical restraint and seclusion as a disciplinary tool in Connecticut schools. Perhaps you can comment on that and what led up to that and why is it needed?
Well, restraint and seclusion are being used, unfortunately, in many situations as something that's convenient, and I don't say that lightly, and I know that school staff and administrators, they don't take it lightly, but they are often in a position where their classes are very large, they have many behavioral issues, and there's times where they don't have the training or the resources to engage other than the use of restraint and seclusions, at least in their current situation, right? So what we had found is that in 2012, there was some incidents that brought a lot of attention to this, which is typically what happens, and then we do something up at the Capitol. And what we found was that they started to collect data on how often restraint and seclusion was used, and we could look and see where it's being used too much. Some of the things that were really concerning were, for instance, one school district had 155 incidents. 150 of those were with the same child.
Oh, wow.
When I read that, I said immediately, Why were they not back at the table? The plan's not working, right? There needs to be another plan. But we also found that although the data was only required to, and the rules and regulations were only required for those kids who are identified special ed, it was also happening with regular ed students, but it wasn't, it wasn't being collected, the data wasn't being followed. So what we did this year is we took this, what was happening was special ed was considered under law at risk. And it was in not the educational statutes that are followed, but it was in this whole other separate set of statutes. And it was those that cover things like, your juvenile justice facilities or things like that. We took out all restraint and seclusion when it's in a school setting. We put it into the school statutes. And we then changed some things. We said, you can still have it in your IEP, your individual education plan, but you can have it there as, you have thresholds to meet before you can do that. It's got to be only in an emergency. If there's imminent risk of harm to that child or to another.
Right.
We also changed some of the things like that child I mentioned had 150 of the 155 incidents. If there are 4 incidents or more in one chunk of time, 1 month period, which is 20 school days, then you have to go back to the PPT. If they're special ed, you must go back. If they're regular ed, you must convene a meeting with the teachers and educators and parents about that because it's not working. You can no longer have any student go into just a padded, secluded room with no windows, anything of that sort. There has to be a line of sight now. That student has to be visible. And if, in fact, any of these interventions for restraint and seclusion, if it's going to go beyond, if it can only last 15 minutes or less, if the emergency abates, you have to stop. And if you feel the emergency is still continuing, you have to get that signed off on. And then after that, every half hour, an administrator or someone else appointed in that school has to sign off on it. Because we heard of kids that were in these rooms for 2 hours. Oh my. So if there is that reason and that need, well, you have to be willing to sign on that. So there are many more changes, and I know we don't have all that much time, but hopefully, I believe these are all very positive changes within our system.
As I was reading about this, up until the time that the statute was, or the bill was initiated, there was 30,000 incidences in Connecticut in a 3-year period with 2,500 students. So this is a big issue. It
is a very big issue. And again, those are only that were mandated to have been followed and reported. Those are only the special education students. We don't even know how often it's happening with regular ed students, but we've been told that it is. But then there's this other piece of it that we have to be careful about, and that is that what is the definition of seclusion, right? So especially with situations like autism or some other, some other conditions. Well, they really can, for instance, even my son who had sensory integration dysfunction, they could really benefit from low light, quiet, maybe some soft music, comfortable place, but
it's safe.
It doesn't have to be a seclusion room. It can be that therapeutic time out. It can be, soft and comfy and calming. And that's what we should be looking at, especially, I believe, for children on the spectrum, as opposed to, you put in an IEP that they just go to a seclusion room. That's very different from a therapeutic time out.
Is there any kind of specific training that's going to be given to school administrators?
I'm glad you brought that up. So there is. So many of these things were immediately required to change. But we also acknowledge that, as I said before, teachers need training, they need supports, and they are happy and willing to do that. They don't want to have to restrain and seclude a child. So we worked with the State Department of Education to implement and phase in a 3-year plan. So first they will right now identify a crisis team in each school who is currently trained. And no one else can do it. And then they will eventually start to phase in training of more employees. So, if you're not trained on it, you shouldn't be restraining or secluding a child.
Right. And this will have an effect for those on the spectrum because it'll be a much more gentle approach. They'll prefer less restrictive means initially. So
absolutely.
So the law really has a great promise. So.
And we found and we heard that, you know, there were some school districts who routinely, if it was autism, they routinely had part of their IEP, their individualized education plan, immediately go to seclusion. Well, you know, I personally believe that there are steps that can happen before that.
Sure.
Not that you never will need, you know, to use restraint or seclusion if there's an emergency. But you have to hit that threshold of emergency, which means imminent danger.
Right, right. And there has to be some laddering. So you have to prefer the lesser restrictive means first.
Right.
So what's the stage of that bill? Is it still being considered, or has it?
Oh, no, it passed.
It did pass, okay.
It passed last session. And actually, so it's now just as far as the training being phased in and the, you know, that's in the works.
Good, excellent. Well, that's exciting. Now, I know we talked a little bit about some other laws as well, and one of the things I was hoping you could comment a little bit about is the ABLE Act. I don't think a lot of people are aware of that. Now, I know it's not a state law, it's a federal law, but it's implemented somehow on the state level. But perhaps you could comment a little bit about that so our audience can understand that and look into it.
Well, so the ABLE Act, as you said, is federal legislation, but what it allows us to do, and in the state of Connecticut, we passed legislation in order to be compliant with the components of the ABLE Act. So what we did was we now have the treasurer of the state of Connecticut will help to set up savings accounts so that people with children on the autism spectrum that they can put money away, put savings away, and it's tax-free as long as it's used for certain types of medical expenses or housing or those kinds of things, education. So, you know, I think it's whether they have autism or some other type of disability, it makes a whole lot of sense. I mean, I know I have people in my life, I mentioned my sister, you know, she's working and she's going to school and she has her own apartment, but the restrictions on how much she can earn or how many hours she can work, or they start to take away other funding, you know, they really kind of keep down someone who's really working hard to, you know, to come up and to be a productive member of society and to have that pride of working and living independently. But if you are kind of cut off at the knees because you can't save enough money or they take away what you're now using for those daily expenses, you know, we don't get very far.
No, you're absolutely right. And I think the way it works now is that you can only have up to $2,000 per month. And what the ABLE Act does is give you the ability to have up to $100,000 before you have that restriction. So if I understand that correctly, you know,
I believe you do, but I'm not as up on the federal.
But that's
issue.
exciting.
Yes.
And I think you can even have up to $300,000, but they also will restrict it over $100,000. So there's an opportunity now for families to. You don't have to be restricted to the $2,000 per month. You can look into the ABLE Act, and that's something that.
I think it's wonderful.
Yeah, I do too. I think it's a great idea. So what are the new challenges that you're facing? What are the things that you've got a great track record, a couple of bills that have been enacted into law. Congratulations.
Thank you.
So what are the new challenges that you're looking to do?
Well, you know, so when we're talking about this area of children's mental health, I think there's just so much more we can do. I think that, you know, we will continue to work on this plan, which ultimately the goal, and I would hope within like 5 years, is that we have our insurance companies paying for the same kinds of services. Our public insurance, our Medicaid, our Husky is much, much more robust in what it pays for than many of the private insurers. And so when you hear about things like children being held up in the emergency rooms or the EDs, whichever ERs, EDs, you know, often that's actually 75% of those are kids who have private insurance. And what we see happening, unfortunately, is that parents are doing really dramatic things to get their children on public insurance for the better services. Divorces, things of that sort, so that their finances get them to the point where they can qualify. Nobody should have to do that.
Right, right. So is there an opportunity to change that? Are there going to be, what do you see as a way you can
we're working on it.
that?
I don't even know exactly at this point in time, but the director of Medicaid is sitting on this advisory committee around our mental health plan. There's things that we've talked about all the time. There's certain things like in other states, I think one state even allows up to 14 days before before a doctor has to, and an inpatient, call and check with that insurance provider, because we were finding, kids would go in for one day, the doctor would call and say, I think they need more time. The insurance company would say, a doctor sitting somewhere in the other part of the country on a phone would say, no, we're not going to approve that. So there's things that we are working on. We made a little bit of progress on some of that this year, but the opportunities are endless.
I understand. It can seem like a long battle. So if someone wanted to learn more about what's going on at the state legislature, is there a website they can go to or phone number they can call? Perhaps you could tell us what that would be?
Right. So if somebody goes on to www.cga for Connecticut General Assembly, .ct for Connecticut.gov, so cga.ct.gov, there are opportunities to look at specific committees. So if they know that they're interested in the area of education, they could go under that. There's all committees listed there. They will then, when we are in session, they will show you what bills are out there. If it's somebody in my district and they're interested in a certain topic, they can call me. My number in Hartford's 860-240-0441. 860-240-0441, and tell me what their issue or concern is, and we'll do our best to get them in the right place.
Oh, that's great, great. So, Senator, any concluding thoughts you'd like to share with our audience before we conclude today?
Well, the only thing I can think of is how fantastic your crew is.
Thank you.
And we even have one member of the crew, Dylan, who's come to Hartford to visit me. I would love to see the others come visit if ever they have any interest in doing that. But I'm just so impressed with the work that they all do, and I just want to thank them. And you as well.
Well, well, let me thank you for coming today and sharing with us. That's pretty exciting. So there's a lot of encouraging work that's being done at the legislature for those on the spectrum. So we appreciate all the work you're doing. Keep up the great work.
Thank you.
And you and your team in Hartford. So thank you for your services.
Thank you, Larry.
That's really super. We hope you enjoyed our show today and hearing from Senator Bartolomeo about the laws that are being enacted in Hartford and on the new bills that are coming up, and for those on the spectrum and how they can benefit. I'm Larry Walters, and I hope you'll join us again on a future program. And so from all of us here at On the Spectrum, thanks for watching, and goodbye.
People last spent this morning on an early grave, and when they say goodbye, none left to say. Time took the turn, turn not to